Imagine a baby having to fight for their very first breath, a life-or-death struggle caused by a simple hole. Today we're going to dive into the story of a rare birth defect and the medical revolution that's giving these tiny fighters a chance, sometimes even before they're born.
Okay, let's start here. Up until the 1990s, this number was the heartbreaking reality for babies born with something called Congenital Diaphragmatic Hernia, or CDH. More than half of them didn't survive. It was an absolutely devastating diagnosis.
So what exactly is this condition that used to be so deadly? Let's get right to the heart of the problem. I know it sounds like something straight out of science fiction, right? But for about 1 in every 4,000 babies, this is the anatomical reality they are born into. And that right there is the core of what CDH is.
You know, the diaphragm, it's that crucial muscle that separates your chest from your abdomen. It's what powers your breathing. Well, in CDH, during fetal development, that muscle just doesn't close all the way. It leaves a hole, and that hole becomes a doorway for organs to move where they don't belong.
And this is maybe the most critical thing to understand. The hole itself, that's a structural problem that surgeons can fix. The real life-threatening crisis isn't the hole itself, but what it causes. All those abdominal organs moving up into the chest physically crowd and crush the developing lungs.
So this crowding of the lungs, it sets up this intense life-or-death struggle right from that very first breath. Let's dig into why that is.
Because they've been crowded out the whole time, the lungs aren't just small, they're fundamentally underdeveloped. I mean, you're talking fewer of the tiny branching airways you need to exchange oxygen, a much less developed network of blood vessels, and the vessels that are there are often thick and stiff.
This really captures the two-front war these newborns are fighting. On one side, their tiny lungs just can't get enough oxygen into the blood, and on the other, those stiff blood vessels create dangerously high blood pressure in the lungs, which puts this incredible strain on their little hearts.
Now, for decades, the logical response seemed pretty obvious. There's a hole, let's go fix it, immediately. But then, a major shift in thinking completely changed the game, and honestly, it dramatically improved survival.
The old approach was to rush these incredibly fragile newborns right into the operating room. But doctors started to realize that performing major surgery on a baby who could barely breathe was often just making things worse. So the new philosophy became lungs first, hole second.
And this really gets to the heart of that powerful realization. Just stitching the diaphragm closed doesn't magically make those underdeveloped lungs work. You have to address the underlying lung problem first for the surgery to have any chance of success.
So this is the modern playbook. First thing, you secure the airway. But, and this is key, you do it gently. The idea of gentle ventilation was a huge breakthrough. It means using lower pressures on the ventilator to avoid damaging those delicate lungs. The whole focus is on giving the baby's body time to stabilize and adapt before you introduce the massive stress of surgery.
And for the sickest of these infants, we have this incredible technology. ECMO is essentially an artificial lung and heart outside the body. It does all the hard work, taking blood out, adding oxygen, and pumping it back in, giving the baby's own organs this desperately needed break. It's a bridge to get them strong enough for surgery and recovery.
So thanks to these massive advances in care, survival rates have just skyrocketed. But here's the thing. For these little fighters, winning that battle in the NICU is often just the beginning of a much, much longer journey.
And you can see here, the impact of CDH can last for years. A huge percentage of survivors face ongoing challenges. We're talking about everything from breathing and feeding problems to developmental delays. It really takes a whole team of specialists to provide that long-term care.
A huge factor in how these kids do long-term is the size of that original hole. If it's small, surgeons can often do what's called a primary repair, where they just stitch the muscle back together. But if the defect is too big, there's not enough tissue, so they have to use a patch to close that gap. And that difference, well, it's pretty significant. A primary repair is really durable, less than a 5% chance of the hernia coming back. But for those who need a patch, the risk is much higher, around 30%. A synthetic patch, after all, can't grow with the child.
Okay, so care after birth is now incredibly advanced. So where does the fight go from here? Well, the new frontier has moved into this unbelievable arena, the time before the baby is even born. This is the question that's driving some of the most mind-blowing research in medicine today. What if you didn't have to wait for that crisis right after birth? What if you could actually intervene in the womb to help those lungs grow?
And the breakthrough idea, you're not going to believe this, it didn't even come from studying CDH. It came from looking at this totally different, even rarer condition that had the exact opposite problem.
It's a condition called chaos. In these fetuses, the airway is blocked, so the natural fluid the lungs make gets trapped inside. It builds up pressure and stretches the lung tissue, causing them to become massive. And seeing this sparked a wild, revolutionary idea. Wait a minute, what if we could do that on purpose?
And that idea led to this procedure, FETO. Using minimally invasive surgery on the fetus, surgeons place a teeny tiny balloon in the windpipe. It's a temporary, intentional blockage. This traps that lung fluid, builds pressure, and stimulates those underdeveloped lungs to actually grow before birth. It's all about giving the baby a better fighting chance from the moment they're born.
The future here is just so exciting. I mean, research is firing on all cylinders. We're talking about making these fetal surgeries even safer, exploring stem cells to heal damaged lungs, engineering better patches that can actually grow with the child, and creating lifelong care programs to make sure these survivors don't just survive, but really thrive.
The story of CDH is just this remarkable journey, from what was once an almost certain tragedy to a story of incredible hope and innovation. And it forces us to ask this huge question. As we get better at treating problems in the womb, the line for when care actually begins is constantly being redrawn, offering more hope with every single new discovery.